Most of us know someone who has undergone hip replacement surgery or knee replacement, but ankle replacement? Yes. And this new surgery is far superior to anything that's been offered before.
Can you move it up and down for me?
It wasn't long ago that Larry Colley couldn't do this or this. But ever since Larry had a double ankle replacement, he feels like a new man. Dr. Greg Berlet, an orthopedic surgeon at Dublin Methodist Hospital, is using revolutionary surgery to replace the ankle joint to allow freedom of movement and freedom of pain.
I'm amazed. I couldn't believe it, that it could be that simple. And I'm sure it's not that simple. He just made it seem that simple. So anyway, I could not be happier with what he's done.
What Dr. Berlet has done is replace Larry's arthritic ankles with a metal and plastic device.
It allows people a chance to get pain relief and function, whereas before, with ankle fusion, which was the alternative, we did very good for pain relief, but we did it at a functional cost. And for some people, that just wasn't good enough.
Larry was in so much pain before the procedure he needed a cane to walk and couldn't walk more than a few steps at a time. Larry wanted to get back to his active lifestyle, so he opted for the total ankle replacement.
We're looking at a picture here of an ankle. The bottom of the foot would be down here. This is the knee up here. And what's going on with ankle arthritis is if this is the top bone, the bottom bone, the cushioning between those bones has disappeared. That's what arthritis is. So you're rubbing bone on bone, which irritates the nerves, and that's why it hurts. So what we've done is we've replaced or removed a small section of bone. We've replaced it with metal. We've put a cap over this bone down here, kind of like capping a tooth, and then there's a piece of plastic in between. So there's metal, the cap, and then the plastic in between, and then the device can move back and forth like that.
This surgery is an alternative to the other option of ankle fusion, and that procedure decreases the ability of the patient to move the ankle up and down.
An ankle fusion is you cure arthritis by removing the joint. And when you fuse an ankle, you remove 2/3 of the up and down motion, which means for many that they walk with a limp, and if they enjoyed some recreational activities, they had to give that up.
Larry is feeling great, and he's back to his golf game. His ankle replacement surgery was performed at OhioHealth's Dublin Methodist Hospital. The 94-bed facility is not quite 2 years old and was built with a patient's recovery in mind. You will find Dublin Methodist a quiet place. The loud paging system has been replaced with Voicera communication devices for all hospital employees.
Okay.
Hi, Dr. Berlet.
Hi, Anita. Have we found out which room our patient's going to?
Voicera is quick, effective, and keeps the hospital halls quiet. Dublin Methodist is a state-of-the-art medical facility. It's nearly paperless, the first one in the state, with electronic medical records, x-rays, and prescriptions available instantly. The design of the hospital is to promote comfort and healing with calming waterfalls, natural light, and 13 gardens and courtyards where patients can spend time with family.
There is research that tells us to the extent that we can bring the outdoors in, to the extent that we can make the environment more quiet, to the extent that we can provide for family members to spend time in patient rooms, all of those things actually help to promote healing, increase patient satisfaction, decrease infection rates. So there's a whole body of knowledge called evidence-based design that gave us lots of research to draw from.
Dublin Methodist is a community hospital with an emergency room and maternity center, but is evolving into a surgery center as well.
The reaction from patients has been really outstanding. One of the things that we were concerned about when we opened actually was being able to live up to what people might expect of us, and that has actually turned out to be not so much of a problem for us. So our patient satisfaction scores, we use a national patient satisfaction survey, and our patient satisfaction scores have really been very good ever since we opened.
Dublin Methodist Hospital is part of the OhioHealth hospital system.